Hello. My name is Dr. Diamond. I'm going to be taking care of you today. I know we're going to do just a quick overview exam of your teeth, and then you had a concern because you have a small cavity in between the front bottom. Yeah? Okay. No worries. We're going to get that fixed for you. Do not be nervous. You are in the best hands, and we'll make sure that you're comfortable the entire time. Let me take a look at that front cavity. Go ahead and just smile for me. Do you have any sensitivity to air, hot, cold, or sweets in that spot? A little bit to sweets. Okay, let me see. Open up just a little bit more. Just checking your gum line here on the bottom of these front teeth. You have just a little bit of inflammation. It's not bad. It's not anything like periodontal disease. Just slight irritation. Have you been flossing down here? Oh, not as much because it's a little sensitive. I completely understand. We want to make sure we take care of that for you today because I don't want you to have to go without flossing due to sensitivity from a little bit of a cavity. It's not much. I'd even almost want to say it's a pit. It's not a large cavity. It is pretty much actually on the bottom left tooth. It's not in the middle like you thought. Yeah, exactly. So, what we'll do, how do you feel about the filling? Do you feel nervous if we do that? A little bit nervous? What part makes you nervous? Do you not like the sound of the drill? Do you not like how the vibration feels? Are you scared about the pain? Do you not like getting Novocaine? Okay, just a little sense of feeling out of control. No worries. What we'll do, so usually you know how when you get Novocaine they tend to look like really big scary syringes? Yeah, I hate those. I have a very small syringe that's going to deliver the same exact optimal results for Novocaine. We'll give you, smile, a little injection right here in your gum line. Do you feel that little pick? Right here. Just down further, okay? And then you're gonna start feeling numb almost instantly. But while you're getting numb, I'll just do a quick overview of your other teeth. Tap around, scrape around, wiggle. Make sure I don't feel any movement. Scrape a little bit on the sides and the top. Make sure I don't feel any pits or any like divots down in the gums. And then you'll be numb. We will just use the drill very slightly because, as I mentioned, smile a little bit more. It's such a superficial little pit that it's not going to take much more than a quick little zap with the drill. We'll put in the filler. It's like I want to call it a paste, but it's similar to a paste. Then we harden it with a light. After we do that, we'll take the file very lightly, just glaze off the top. Graze off the top. And then just make sure it's super smooth and flush with the rest of your tooth. There's no gaps. There's no anywhere that's rough or sticking up. No jagged pieces. And you'll be good, okay? Alright. If you're feeling nervous at all, or if you need a little bit more of a pep talk, or you need me to boost you up because you're like, oh my gosh, I'm actually feeling worse than I thought, just let me know. I'd be happy to do that for you, okay? I don't want you to be scared or having a bad time because I promise you are in good hands. Really quickly, I'm going to take a little bit of this numbing solution and I'm just going to put it down in your gum line where we're going to be injecting you, and it's just going to help take a little bit of the brunt of the pick of the needle. So I know it looks like a lot. I'm just going to pull your lip down and I'm just going to stick that in. Close your mouth. and just hold that flush there, okay? You may notice that you're going to salivate a little bit, and then it's going to feel like if you swallow it, might numb the back of your throat just slightly. Do not be alarmed. Very normal. But we'll get that out of there in just a second, okay? Get you some suction here. Bend this. You might need to hold a little bit. We got these new tubes and they just don't seem to hold as good for the suction. Here you go. Put it in your mouth like a straw and close your lips around it. Perfect, perfect, perfect. And now I'm just going to hold this. And when you need it, you can just raise your hand or you can grab for it, okay? I'm going to lean it right here. Across you. Alright. That bothering you at all? No? Okay. On here we have that. We have our Novocaine here. See, a lot smaller. I know it looks scary, but I promise, way smaller than the big one. Okay. You ready to take that out and start? Yes? Alright, let me see. Open. Alright. I'm going to take your medicine. Just a little tiny pick in the gums. All it is. No worries. I'm going to pull your lip down a bit here. Smile. You can bite your back teeth together. And here we go. You're just going to feel a little bitty pick. 1, 2, 3. Good. Good job, good job, good job, good job. Might feel just a little bit of a burn. Normal. Good job. Okay. And you can relax. I'll give you just a second if you want to rub your lip at all if that hurts. Going to rub it, and then I'm going to explore the rest of your teeth. See what's going on here. You're okay? Alright. Need some suction after that. I know it's not the best taste. Here you go. Perfect. Good. Alright, so go ahead and open. I'm just going to take a look with both of these tools and see what we're working with. Let me start in the back here. Nothing else feels loose or is causing you any type of pain? No? Okay. How about right here? Did that hurt at all? Okay. Alright, go ahead and relax your mouth for a second. Swallow if you have to. Perfect. Now I want you to lift your chin up just a little bit, and I'm going to have you open your mouth again. I'm going to check your top teeth. We're going to start in the back. Sorry, I know the scratching noise is a bit like, nobody likes that, but it's actually how we check to see if the tooth is loose. You gotta swallow? Go ahead. No worries, we're almost done with this part. Good. Chin up just a little bit more. Okay. Okay, perfect. I definitely think the only thing we're worried about today is that little pit between your two teeth. Now, I guess I should ask you with this. I'm going to poke the gum line just around that area and you tell me if you're feeling any bit of pain. Anything? No pain? Looks like we're ready to begin then. So what I want you to do, this is all the drill looks like. It's not that big. It's not that scary. I'm just going to zap a couple areas right here that I think need to be filed down. We'll take a look, see how it looks. Put the filling material in and cure it, okay? Alright, I want you to just smile for me. Okay, and here we go. Just stay just like that. No, I told you. I think that's really it. Let's take a look. Let me see. Perfect. There you go. Good. Close your lips around that. Good. Good. Let's go ahead and just take a little ball amount on here. Okay, go ahead and smile. We're going to start with this little bit right here of material. It may feel like I'm kind of like patting you in your head, literally, but just packing that into your little pit that we just made. And then we're going to do one more layer of this, and you should be good. We'll make sure it's buffed out really smooth with the drill. You still doing okay? No discomfort or pain? No? Okay. Let's do our one last little bit thicker layer there. Just make sure it doesn't. Got one last cure for that. Good job. You're doing amazing. Told you it wouldn't be so bad, right? Good. Okay. And let's just polish it. Let me scrape one time just to make sure that there's no margins or anything like that. Let's see. I know you probably, I don't know if you can hear that or not, but it is flush and smooth. It's not catching anywhere. That's exactly what we want. I'm just going to take the drill and polish just the tiniest little bit, like zap, 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 and that's it, okay? Then you'll be out of here. Smile. Here we go. Alright, that is it. Take a look in the mirror, see what you think here. You love that so much better, right? And I think that the filling material we used, perfect color match for your teeth. You cannot even tell you had anything there. Oh, you're so welcome. I'm glad you like it. Give it a couple hours for the numbing to wear off before you can really eat or drink. You can drink. It might be hard to drink out of a straw. It might leak a little bit out of the corner of your mouth because your lips won't be able to seal well. Don't eat anything really that you have to chew until it wears off because you don't want to be biting your cheek and shredding it. Anything else, just give us a call, okay? Alright, bye.